Okay, thank you. So thank you, the Kamalji sir, Ruchi and KP sir. Thank you for inviting me here. My talk is the cataract surgery in the glaucoma patient, and so here you will see can see the global prevalence of the glaucoma. If you see today, in India in 2025, it is 12 million people are having the glaucoma, and if you see the worldwide, so in 2040, it will be 111 million people. They may be having the glaucoma, and you can see the magnitude. In 202, it was 4.4 million, and after this 40 years, it is 111 million population of the glaucoma will be there. Now the risk factors, as you know, maybe African race, or you can say the habitations, or this apna male and age, like that. So what is modifiable in this? What is modifiable in this is the intraocular pressure. Then we can modify the medicines if you are treating this. Then laser and cataract. It means these are the modifiable thing which happens in the glaucoma. And then the open angle cataract surgery lowered. These are the all studies. Intraocular pressure average of 1.5 millimeter of mercury after up to 3 years. And the higher the initial IOP, the greater the magnitude of the IOP reduction when you go for the cataract. Now closed angle glaucoma cataract surgery lowered IOP an average of 6.9. So that is what is reduced in the closed angle glaucoma. And ocular hypertension, if it is there, then the cataract surgery lowers there about 6.5% of the IOP in the such type of glaucoma. Now the pseudo exfoliation, the surgery maintains IOP better than the phakic patients. So if you remove it, it helps. And then the glaucoma diagnostic hurdles, the cause of the cataract. See, because of the cataract, there are so many hurdles in the diagnosis of the glaucoma. What are the hurdles? You can see the perimetry diagnosis. You see in your right side, the preoperative and postoperative, you can see the changes in the field. Now that is what happens, and this is the cataract removal significantly increase the signal strength in OCT, and the measurement of the RNFL is better when you remove the cataract. Then the another thing always comes is the what is first, chicken or egg. Now see the cataract or trap. So if there is a glaucoma, Malik sir told he operate both together. So everybody, because this chicken and egg is the problem, so better. So now the what happens? We will see both. If the trap is first, 20% of the cases develop cataract post-operatively after 5 years. If you do the trap first, early cataract post-trap holds high chances of failure. It means there may be a failure. And angle closure cataract after the trap further reduces the IOP. So that is what happened. Now what if the cataract is first? The conjunctiva can get fibrosed. So you will have to go the temporal side. Don't do the superior side. Improves the vision even in advanced glaucoma. Though there is a glaucoma, patient feels his vision is improved, and patient will not come to you, because though there is a tubular vision, he only sees in the center, and so he get a pseudo expectation that after cataract surgery my vision is good, and he will come to you when he is blind. So that happens when you do the cataract. Now again the coffee or tea. It means what do we want? See, cataract or trap. So what is first? So again we will just discuss it. If the cataract first, the reduces the IOP, but trabeculotomy controls the IOP. That is the difference. See here, more anti-glaucoma medications required in the cataract, because you get the hypertension after cataract surgery, and then less anti-glaucoma after the trabeculotomy. Then you can less surgical complications in cataract, more surgical complication in the trabeculotomy. Then you can see they can reduce IOP in uncontrolled fashion in some different type of things, but not controlled one. Increases the chances of cataract formation more, and here can reduce the IOP in controlled cases. So that is what is may differ the need of trabeculectomy if you do the cataract and control this one. Now again there is a what he will do first. So he will go for the cataract, and now they see here long term outcome of the combined cataract surgery and trabeculectomy using trabeculectomy for coexisting cataract and open angle glaucoma. You can see 5-year follow-up. The reduction in IOP is more than a single procedure. It means if the trab is done and if the cataract is done, the IOP reduction is more than what happens in one surgery. Two surgery together reduces more IOP. So whenever you are doing it, you will have to also consider that. Combined cataract extraction and trabeculectomy by an internal approach, coexisting cataract and open angle glaucoma. So these are the initial results what I told you. Now see, this is the patient PL positive in the right eye, left eye 6/36, and the IOP is 45 and 20. Now right eye has an intumescent cataract causing the phakomorphic glaucoma. In such situations, if you go for that, the just surgery, that will help you that the glaucoma will be reduced. Now this is the other patient having the 6/9 vision and clear lens, but angles are occludable angles. So here what will happen? You see laser PI or lens extraction, what you will prepare. So in that you can see effectiveness of the early lens extraction for the treatment of primary close angle glaucoma. A randomized study says that this removal of cataract gives good result or the better result. Can see clear lens extraction showed the greater efficacy and was more cost effective than laser peripheral iridotomy and should be considered as one of the option in clear lens extraction. And in clear lens extraction, can say it gives better result than the mature cataract. So do's and don't of the surgery are there. Avoid superior incision, no to congenital plaque procedure, minimal phaco energy, and clear corneal temporal phaco. And now if you want to do the SICS, then you can go for the, see here what I am doing is completely temporal SICS. So you will not go for the you can say the superior SICS. You will just spare the conjunctiva in the superior zone, and you can do the SICS that is on the temporal side. So that can be done, and so that the you have removed the cataract first, see how it behaves, and if the IOP is more, start with the medicines, and if not controlled, then you go for the, you can say, trabeculectomy. So that is what I always feel. So I am not doing combined, but sometimes I always do combined also. So it is not that I am not only doing combined, but I do combine also. So that is what is this. And conclusion. Now the cataract surgery is a safe and effective tool to treat glaucoma cases first, and then followed up by the trabeculectomy SOS combined procedure has also worked well. Plan well, execute stepwise for better outcome. Thank you very much. Thank you, sir.
Well done.